Gout, a form of inflammatory arthritis, is more common in developed countries. Gout is becoming increasingly common. Risk factors for gout include a diet high in meat, seafood, and alcohol, as well as being overweight. Gout was historically called the disease of kings, or rich man's disease. Pathophysiology. Gout is caused by the buildup of uric acid in the body, leading to the formation of urate crystals in joints. Urate crystals cause inflammation and pain in the joints. High levels of uric acid can result from a combination of diet, genetics, and medical conditions. Most cases of gout are caused by the kidneys not excreting enough uric acid. Certain genes can increase the risk of gout by affecting uric acid levels. Medical problems such as metabolic syndrome, kidney failure, and certain blood disorders are associated with gout. Medications like diuretics, niacin, and low-dose aspirin can increase the risk of gout. Humans are more susceptible to gout than most other animals due to the evolutionary loss of an enzyme that breaks down uric acid. Clinical manifestations. Gout typically presents as sudden, intense pain in a joint, often the big toe podagra. Affected joints become red, swollen, tender, and hot. Pain is usually worse at night. Long-term elevated uric acid levels can cause hard nodules called tophi to form. Gout can lead to the development of kidney stones. Management. Lifestyle changes, such as avoiding alcohol and purine-rich foods and losing weight, can help prevent gout attacks. Medications like NSAIDs, colchicine, and glucocorticoids are used to reduce pain and inflammation during an acute attack. Medications to lower uric acid levels, like allopurinol and probenecid, are used to prevent future attacks. Dietary supplements have not been proven to be effective in treating gout. Applying ice to the affected joint may help decrease pain. Prognosis. Gout can be cured by lowering uric acid levels. Without treatment, gout attacks tend to recur and can cause joint damage and tophi formation. Gout is associated with other health problems like heart disease, diabetes, and kidney disease.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.